Hi, Matthew Holt. It's another TCB Spotlight. I have Sach Jain with me. Sach is, although it's a similar name to that other Sach and Jain fellow who I run into occasionally, he is not the same guy of the head of one of the health fund. He is the CEO of Carrum Health, which is a digital health startup. Been around. We've just been chatting offline about the 2014 launch of Health 2.0, which didn't all go that well. So, but you made it through nonetheless. And recently, Carrum has had another quite a big round raised from Omers Ventures this time around, following a quite large round from Tiger in a couple of years back. So, and Carrum is in the business that used to be called Centers of Excellence, but I don't know if you have a new name for it now. So, Sach, welcome to TCB Spotlight, and just remind people what Carrum does.
Right. Hey, Matthew, thank you for the invitation. So happy to be here. So we still call ourselves as a Centers of Excellence solution company. And to give you a little bit more context, we launched the company back in 2014 with the goal to change healthcare payment model away from fee-for-service to value-based care. And value-based care, as you probably know, has been a big buzzword over the last decade, but the success stories have been few and far between. And at Carrum Health, we took a little bit of a different approach to value-based care by bringing purchasers, providers, and patients on the same platform and aligning their incentives. So what we do is we partner with employers who are our customers. And once they adopt into Carrum, we start shifting their spend on surgical complex care episodes from their PPO network to our platform, where these employees pay less, members have better outcomes, and better experience. We are doing that today across multiple specialties, including orthopedic, spine, bariatrics, cardiovascular, and now oncology. We have a few million lives on the platform now. Our network covers almost 90% of the US population that lives within drivable distance of one of our COEs. And we have raised roughly $95+ million in financing.
All right, great summary there. So the business of, and I'll talk a bit about your business in a second, but I want to talk about Centers of Excellence as a whole. The concept's pretty simple. I mean, I go back to the early 90s when Delta Airlines and Walmart and others were playing this. No, saying essentially, if it costs half the price at the Mayo Clinic that it costs on average for heart surgery or back surgery or whatever it is, than it costs at our local hospital, and it's got the Mayo Clinic or the Cleveland Clinic quality, why not send our people there, cut them a deal, made their copay less or nothing, and send them there and spend half the amount. Sounds logical. Took a long while to take off as a concept. And as you mentioned, value-based care as a whole, the idea that we could somehow do everything better but cheaper is tricky. In fact, next week I'm doing a special podcast with the Robertson brothers who written a book called Better and Cheaper. But it's been tough to do that. So first off, why has this been such a slow burn to take off? What's stopping everyone going, well, this is just damn obvious. I should, buy Carrum for my specialty care and get and save money. So what's been stopping it taking off?
Yeah. What was stopping it from taking off was that no one made it easy, either for employers or providers, to adopt these solutions until Carrum came in. So you are right that the concept exists for decades. And employers you mentioned like Walmart, United Airlines, Delta, Lowe's, etc., saw the value in a concept like this, where they can contract directly with some of these best of the best providers, and call them Centers of Excellence in the country, and have a direct relationship with them and start sending their members over there. On paper, these arrangements showed a lot of promise because, to your point, you can have a direct deal with a Mayo Clinic and a Cleveland Clinic and you pay less in those direct arrangements. And obviously, members will have access to the best of the best providers in the country. The challenge with those arrangements have been is that one, they are very difficult to put in place. So for an employer like even of the caliber of the Walmart, it was okay to get it done in roughly half dozen of the markets. But Walmart has employees all across the country. Lowe's has employees all across the country. For them to do these direct deals with providers on an ongoing basis is very challenging. The benefit stream there are also, not very large. And so they got it done in a handful of markets, but that means employees were flying from one part of the country to another to get access to, these COEs. That was one challenge. The second challenge was, even for the providers, it was easy to do a deal with the caliber, if an employer of the size of a Walmart or a Lowe's, but to make the volume meaningful in these arrangements, you have to do dozens, if not hundreds of deals. And that is a challenging undertaking. And, putting arrangements in place is one thing, but driving the engagement among the members to use these programs is another. And neither the employer or the provider, or as we call them, COEs, have any capability to drive engagement in these programs. So we saw that as a huge white space. As we were thinking about where do we start on our value-based care journey, and we felt if we could create a value-based care platform where we are partnering with the best of the best providers in the country, bringing them on our platform using these standard bundle payment contracts. And then we are able to aggregate the demand of the employers through our platform and make the match. Then these programs will become much more easier to adopt and scale. And we are doing that at the back of a technology platform. We spent our first 4 or 5 years building out this platform, which is now state of the art, and make it easy for employers and providers to, first of all, adopt this program. And then we also serve patients through our platform and streamline the entire surgical care experience for them using the technology.
Okay, so let's dive into that patient experience. So I'm, an employee at one of your employer customers, and I have, back pain or knee pain or whatever. What happens next? How do I get from going using my benefits or going to my regular GP or finding a local orthopedic session or whatever to getting in touch with Carrum and finding out that I should be? What's the process I go through?
Yeah, I think that is where the biggest impact of our solution is, that how we dramatically change the member experience. So to your point, you are, let's say, an employee of United Airlines, and you have a knee pain issue, and so in the absence of Carrum, you would rely on your uncle's recommendation of, my orthopod over there does good surgeries, and you should go there. So you have very little data to work with. And then, even if you manage to find a good surgeon, good facility to get this procedure done, you still have no idea what happens before the surgery, what happens during the surgery, what happens after the surgery. And more importantly, you don't even know if I need a surgery. What if there is a more conservative treatment available that can help with my condition? That is the part that we struggle with, this whole process of surgical care delivery. And the final part that you find most challenging in the PPO networks, which is no one can tell me how much will it cost. I think I have good insurance, but we hear these stories all the time where you walk into a hospital or ASC, and thinking you have a nice insurance, they are part of the network, and the stream of the bills start coming your way. And it turns out anesthesiologist is out of network. And you're like, how would I have known that? And then, after even after you had a great insurance, you're sitting with tens of thousands of dollars worth of bill. Now contrast that with the experience that we have built at Carrum, where we have identified through our rigorous quality evaluation process who are best of the best facilities and surgeons near you that excel in the care delivery of that procedure. We have contracts with those centers of excellence where the entire episode of the care is covered as part of that bundle. And every bundle comes with a warranty. And I'll cover that in a minute. So as a member, you come on our platform or you give us a call, we show you the list of the options available near you. You can review the details of the facility, you can review the details of the surgeons, and you make an informed decision, where do you want to go for this procedure? The surgeon will evaluate you first to make sure you indeed need a surgery. If you don't need a surgery, they will recommend you a more conservative treatment. And in addition to the technology, we will give you a care concierge person that will help you through the entire episode of care. So all your questions, you can answer that person. You can ask it from that person. But the best part is through our technology platform and specifically through our patient app, we have virtualized every single step in the care delivery. So from form filling to the provider selection, to the scheduling, to the medical record collection, to the consultation, you can do that from the comfort of your home. You don't have to step in the facility or the doctor's office for nothing except getting the surgery done. And even if you need a surgery, you show up at the hospital, you show the Carrum card, which is also embedded within our app, and you'll be taken from there. And the best part is you'll never see any medical bill. That's the guarantee. Yeah.
So do the patients, in general, in terms of their benefits, do they have incentives to choose the Carrum network in addition to like not getting a bill in their services? Do they get a slice of the savings? Do they get a lower premium rate? Is there something else going on here that drives patients to the network in general, or does that vary?
That's exactly right. So almost all our employers waive the out-of-pocket expenses for the members to participate in the program. So from an employer, they save roughly $16,000 on every procedure that happens through Carrum, just from a unit cost basis. And they're happy to waive a few $1,000s for the members to incentivize them to use the program.
All right. So two questions, these may be related. So the first one is, there's a lot of discussion here about, well, unnecessary surgery, unnecessary back surgery, et cetera, et cetera. Yeah. And you come and use Carrum, or you use one of the navigators and you're aligned with a bunch of them to do that, and we'll quote unquote drive out the unnecessary surgery or go to more conservative treatment. That all sounds great in theory, but how do you get to that point? Who's helping the patient make that decision? Does that happen when they get to the surgeon for the thing they think they want? Does it get before they get there upstream with a Carrum care concierge person or someone else? Because if you go back to value-based care, right, which is
exactly,
usually that happens at a primary care level, where someone in the primary care group says, okay, let's do the more conservative treatment first before we refer out to specialties. And usually the primary care doctors are the ones, in the value-based, in the Kaiser type model or in the Oak Street type model, who make, basically are incented to stop people getting out to surgery. So where does that sort of process of stopping unnecessary surgery happen in your model?
Yes, great question. And I mean, you obviously are speaking from your experience, Matt.
Oh, I'm a PPO guy. I go straight to the surgeon. I don't worry about it. ignore what I do and listen to what I say. Yeah.
The process starts a step earlier, where our focus is on finding surgeons who do surgeries when they are necessary. So as part of the quality evaluation process, we spend a disproportionate amount of time finding those surgeons, who have a more conservative way of delivering care and do surgeries when they are necessary. But that's not enough. That's our step to help us set up for the success. After that, we realign the incentives where, in our program, what we call, there are two kind of bundles. One we call as an assessment bundle, and second is called the full, surgical care bundle. If a member comes to one of our COE surgeons and they recommend against a surgery, the provider is paid, what we call as an assessment bundle price, which is typically higher than above market rates. So that, we want to make sure providers who are making the right decisions are also compensated fairly. And this approach really works. I mean, finding the best surgeons who are conservative to start with, and after that, incentivizing them to make sure they can make a decision in incentive neutral fashion before they move forward with the surgery. That approach really works. To make it more real for you, RAND Corporation, which is a big think tank in this space, they conducted a peer-reviewed study on Carrum that was published in Health Affairs. And what they found was that when employers implemented Carrum, in 30% of the cases, when members came to us with a recommendation for a surgery, they did not end up getting a surgery. And when the surgery did happen, employers paid 45% lower on the unit cost compared to what they were paying through the PPO plan, and readmission and complications rate came down by 80%. So it combined these factors, and it really becomes real that value-based care can work if you do it correctly.
That's interesting. So let's talk a little bit about how employers are buying care. And obviously in the last 5 years, 10 years, you had the growth of these navigators. And as partners, you have included, you have
Accolade.
You have Accolade on there as well, and I noticed that one of your competitors was bought by Carrum, which is not a navigator according to their CEO, but looks like a navigator to the rest of us. So, so this makes a lot of sense. How do you work with them? And you have a number of other partners, including, PT companies like Hinge Health and Sword and others. How do you sort of, where does that decision get made, and who is advising the member on, or the patient on what? Because it's super complicated for HR people. It's also quite complicated for the members when they're faced with like a laundry list of all these new service companies they don't really understand. So where does Carrum fit in when you have a member who's maybe going to Accolade for advice? What's that process?
Yeah. So let me first share with you, where do we fit in that continuum of different digital health solutions. So primary care, chronic care, and acute care, if you look at the three phases, we squarely sit in the last bucket, which is acute care, and which is where the healthcare spend is. When we think about a member journey, starting from primary care and then chronic care, we are catching members when they have failed to get better through a primary care intervention or the chronic care intervention, and now they're becoming a candidate for a surgical care. We are now catching them, stopping them from going back into the PPO networks. So we partner with players that are playing in the primary care and chronic care space, and obviously navigators that are across the whole continuum. So if you think about our partnership with in the MSK space, like with Hinge Health and Sword, members start their journey over there where they have back pain, they have knee pain, and they try to get better by using one of those solutions. If they get better, that's great. If not, they progress towards surgical care episode, and they are sent to Carrum through a warm referral process. And I'll share a bit of that in a second. Same with navigators, where a member engages with a navigator, whether it's Included Health or Accolade or Rightway or whoever you are, and they guide the member in the right direction, so that the member has the knowledge of the full suite of the other solutions employer has in place. And if the member does not get better and now progressing towards an acute care episode, they are again through the warm referral process are handed to Carrum, and we take the member over there. So we are able to close that loop. for everyone, and also from a care navigation standpoint, because they are able to drive higher level of engagement for a solution like Carrum. They also are able to show higher ROI for the employer through a solution like Carrum.
Yeah, and it's probably, is it an assumption that the sort of the rejected surgery rate, or whatever you want to call that, 30% is lower when they come through that solution? Presumably, if I've been through Hinge or Accolade, they've already sort of weeded out the stuff that could get, that could have stayed with physical therapy or what have you.
You are exactly right.
Yeah. Okay.
You are exactly right. So we actually have done the studies where, on an average, our employers have lower incidence of surgeries because they are already using either an MSK solution or a care navigator solution. And then when they launch Carrum, the incidence goes down even further because of the way we operate this model.
All right, sounds reasonable. So let's wrap up by talking a bit about the business. As I said, you raised about 90 million over time. You said 3 million people on the 3 million lives under management at the moment. How do you get paid?
Yeah.
How do you get paid? How do you make money? And where is the business in that whole evolution? Because it used to be that losing money was a good thing, but I'm not sure how that's doing anymore.
No, it's no longer sexy to lose money. It used to be.
I assume you're still not making that much money because you did just raise a whole bunch. Which so,
yeah,
I was listening to the CEO of Airbnb at a conference on my other day. He's talking about the $4 billion a year free cash flow they have, which that sounds nice compared to most companies we talk about in digital health.
Yeah, I mean, look. Let me share first, how do we make money? So our incentives are very much aligned with the value we are able to deliver to our employers. And, all our revenues come from employers. They do not come from the providers. For providers, they are the supply side of our platform. If they are able to meet our quality standards and are able to price the bundle competitively, we do not charge them anything else. Now, on the employer side, the model that we have is is pay as you go essentially. We have bundle rates available on the platform. Employers adopt the platform without any upfront cost, and as members start using the platform and as we are able to serve more members, we make more money. So for every bundle that we deliver for the member, there is a fees built in our platform that employers pay. They pay the full bundle price, we keep our portion, and we pass on the remaining to the provider. Some employers choose another model where they want to pay us less on the per bundle basis. But in that case, they compensate us with a per member fees that they pay on an ongoing basis.
So the subscription basis plus a bundle fee in one case, or just
a pure subscription
bundle. Which is the majority, or is it fairly evenly split?
Today, I will say the vast majority are employers that are paying us on $0 PEPM, and they just pay on the per bundle.
So your benefit they can use, and when someone wants to use it, because
Exactly.
it gets referred over to you, then you make your money that way, which does imply that you need to be engaging your the members pretty well. That's exciting. So and tell me, give me a sense of the scale of the business, what you're doing, ballpark where you are in revenue, where your employees. Just give me a sense of and how that's been growing.
Yeah, so look, unfortunately, I can't talk about the revenues. We are a private company, but obviously raising financing in this environment is not easy. And if you are able to do so, I mean, we are on a very good trajectory. Over the last 3-4 years, we have been able to grow at the CAGR of 90 to 100% year over year. I mean, in this scale wise, just, we are in 8-digit revenue figure at the moment. You mentioned about profitability earlier. So the reality is that for our core business, which has been orthopedic, spine, bariatrics, and cardiovascular, we could become profitable very soon. But we have this huge opportunity of oncology ahead of us, which is a relatively different than other service lines in terms of its complexity and and how you insert value-based care in oncology. So we felt given the size of the opportunity and interest, we should invest more aggressively. And that's the reason we raised our Series B of $45 million to invest behind oncology. But even after that, we anticipate becoming profitable in a fairly short period of time.
And then final question on sort of, market dynamics and strategy where you're going. Do you think there's you've been talking to employers as to customers. Obviously, the other big growth part of the market here is Medicare Advantage. Have you made steps in that direction? Do you think, when I look at Medicare Advantage, I think most of it's still fee for service, and there's not a lot of value-based care going on underneath the hood. So, what's your sense about? Is that an area where you're thinking of going, have made steps, or holding off for now?
Yeah, look, there is not a day that goes by where some discussion comes up about Medicare Advantage plans. And the reality is that, given we are focused on acute care, which is a much bigger proportion of the spend in Medicare Advantage, Medicare in general, than in commercial. So, and the problem we are solving in the commercial space, there is no reason we cannot solve the problem in Medicare or Medicare Advantage. I think it's just a question of our priorities. There are a lot of ways we can grow this company, and we want to bring this concept to everything in healthcare. But at the moment, we want to be thoughtful about where we spend our time and not spread ourselves too thin. And so oncology is a big area of focus for us for a year or two. And as we come out of that, after building out a full-fledged solution there, we will think about other verticals, including Medicare Advantage.
All right. Well, that didn't sound like an immediate commitment to it. So
yes,
it's interesting. Fantastic. All right. Well, look, I've been talking with Sach Jain. He is the CEO of Carrum Health, which, as we just mentioned, has just raised another $45 million from Omers in the for its business of building out centers of excellence for everybody, essentially, or everybody who's employed by an employer, at least, or covered by an employer. Sach, congrats on the round, and thanks for your time today.
Matthew, it was a pleasure speaking with you. Thank you for having me here.